Hello guys, welcome back to Clinically Clear. So today let's look at occupational diseases. So what are occupational diseases? Workplace related, employment related diseases or injuries or illnesses basically due to occupational hazard exposure. Okay. Now first you have physical agents. Due to physical agents, it could be heat. Heat can mild heat, hot conditions. You can have peripheral vasodilation that causes peripheral pooling of blood that causes syncope. So what do? You just shift the patient to a cooler area so that the blood flow to the brain once again comes back to normal. You can have heat exhaustion, heat cramps because of loss of water, loss of electrolytes. That you just what how do you treat dehydration? You just give rehydration therapy. Then you have certain serious conditions which are due to hypothalamic thermal dysregulation. Normally hypothalamus maintains our body temperature, but here it is dysregulated. So you can have heat hyperpyrexia and heat stroke. Heat stroke is the ultimate emergency. It is the worst case scenario where temperature is more than 40.5 degrees Celsius and sweating is absent. Heat hyperpyrexia, sweating is present and temperature is below 40.5 degrees Celsius. And here the treatment is rapid cooling. Don't go for any rehydration and all. You have to rapidly bring the body temperature back to normal. This is due to heat exposure in during the occupation. Cold exposure, example, ship workers, trench foot, because of continuous exposure, immersion of the foot in cold water. Frostbite, if they're working in very cold conditions, then what happens in the peripheral extremities, the body fluids get crystallization of these body fluids causes ischemia or infarction leading to gangrene. So what do you do for frostbite? You just slowly rewarm the tip of the fingers wherever the gangrene ischemia has set in back into body temperature over 30 half an hour 20 to 30 minutes. You will slowly rewarm it. So that is cold exposure. Radiation exposure, UV radiation in welders can lead to something known as welder's flash. Ionizing radiation can cause cancer, leukemias, sterility. Excessive noise exposure during occupation can lead to occupational deafness. Light exposure can lead to occupational cataract. Pressure can lead to decompression sickness or Caisson's disease. Vibration exposure can lead to, in drillers, example drillers, continuous chronic vibration can lead to white finger syndrome. Chronic vibration, basically what happens, how does this white finger syndrome happen? Chronic vibration, continuously they'll be using these drilling machines, so that causes peripheral vasospasm, Raynaud's phenomenon, that leads to pain, pallor, ischemia, infarction, and eventually even can lead to gangrene. But pallor is the reason why it's called as white finger syndrome. Understood? So physical agents, you have heat syncope, heat exhaustion, heat cramps, heat hyperpyrexia, heat stroke. Cold, you have trench foot, frostbite. You have radiation, welder's flash, cancers, noise, deafness, light, cataract. Pressure, decompression, disease, and vibration, that is chronic vibration leading to pain and pallor. Next, coming to chemical agents. Chemical agents, you have local chemical agents like dermatitis. Local chemical agents like corrosives can lead to dermatitis, and you also have ingestional chemical agents such as heavy metal poisoning. But most important, like lead, arsenic, then mercury. So heavy metal poisoning, ingestional, local exposure to corrosives, acids, alkalis, all that can lead to dermatitis. Then you have inhalational chemical agents, most important, that is pneumoconiosis due to chronic dust inhalation. Now, this I've covered in a separate video, but just organic dust, you can have tobacco, tobaccosis, cotton, bicynosis, sugarcane, bagasosis, moldy hay, farmer's lung. So these are all due to organic dust exposure. Inorganic dust exposure, silica, silicosis, asbestosis, stone lithosis, iron siderosis, coal coal anthracosis or coal worker pneumoconiosis, aluminium aluminosis, barium baritosis. These are all inorganic dust exposures. So remember, chemical agents, inhalational you have dusts, organic, inorganic, ingestional heavy metal, and local you have acids and alkalis, corrosives. Then coming to psychological. Psychological is basically because the worker is not fitting well into the work environment. Worker does not fit well into the job. Sickness, absenteeism. The worker is constantly falling ill, is absent in the job. Depression, hypertension, stress, peptic ulcer, all this anxiety, all this is due to psychological factors where the worker is not fit for the job. Basically, is not adapting well to that job environment. Next comes mechanical agents. Diseases due to mechanical agents, the heavy machinery can lead to accidental injuries. Then you have biological agents. Biological agents, example, animal husbandry, they can get leptospirosis, anthrax, brucellosis. Poultry farming, because of inhalation, not inhalation, because of bird feces, you can have something known as bird fancier's lung disease. Then you have something known as occupational dermatosis. And occupational cancers, very important. X-ray exposure, UV exposure, soot exposure onto the skin. Skin cancer. Skin cancer is the most common occupational cancer. Very important. Skin cancer is the most common occupational cancer. That is skin cancer. Asbestos can lead to mesothelioma. Then chromium exposure, asbestos exposure, soot, lung carcinoma. Vinyl chloride, liver cancer. Wooden dust inhalation, say nasal sinus carcinoma. Ionizing radiation, benzene can lead to leukemias. Benzidine can lead to bladder cancer. So these are all certain occupational exposure where in the occupation, if you have exposure to any one of these, it can lead to occupational cancers. Most common occupational cancer, skin cancer. Okay. So what are the agents? You have physical, chemical, biological, psychological, mechanical, occupational dermatosis, occupational cancer. So these are all the agents causing occupational disease. Next, coming to ergonomics. What are ergonomics? Fitting the job to the worker. Please, it's not fitting the work to the worker. It is fitting the. It is not fitting the worker to the job. It is fitting the job to the worker. Okay. So it is the application of scientific knowledge to the objects, to the work system, to the work environment. Why? So that we can increase both work efficiency as well as worker well-being. Through ergonomics, we can increase the amount of work output and we can also improve worker well-being. So we're taking care of both. It is a win-win scenario. So you can broadly classify ergonomics into physical ergonomics, cognitive ergonomics, and organizational ergonomics. Physical ergonomics are concerned with the physical and psychological stresses on the body due to the job. Okay, so example for improvement in physical ergonomics is adjustable chairs so that they don't get backache. Computers placed at eye level so that there's no neck strain. Ergonomic keyboards, ergonomic mouse so that they don't get carpal tunnel syndrome. These are all certain physical ergonomics. Whereas cognitive ergonomics, it is concerned with mental processes such as perception, understanding, reasoning, and then response. So these are cognitive ergonomics. Example, color coded labels in pharmacy. In a pharmacy, you have rows and rows of medicine, right? If you color code the medicine, then it becomes much easier to understand where it is to go find out the medicine. Becomes much better. Much increased efficiency in work. Electronic health records in hospitals. If you have electronic health records, much easier to navigate instead of having loads of case sheets, case files. If most of it is electronic, digitalized, it becomes much more convenient, right? So this is cognitive ergonomics. Last, coming to organizational ergonomics, where we are concerned with organizational team, organizational policies, organizational system, organizational this thing processes. So example of organizational ergonomics is before every surgery, the surgeon, the nurses, and whoever is involved, they have a team huddle and they discuss the future plan of action. That is one example. Another example is scheduling shifts in hospital. You can't have one doctor working for 40 hours, 50 hours. It will lead to fatigue. It will compromise patient safety. It will decrease efficiency. So by scheduling proper shifts, regular shifts, you can improve the safety for the patients as well as improve the hospital efficiency. This is about ergonomics. Ergonomics, fitting the job to the worker. Application of scientific knowledge to improve both worker efficiency as well as worker well-being. Physical is everything to do with, chair, keyboard, mouse, computer. Whereas cognitive example is color coding the medicine, electronic health records. Organizational ergonomics is team huddle before surgery, scheduling shifts in hospital. That is that. Then coming to radiation hazard and safety. Radiation hazard and safety, you have first of all you have UV rays. UV, first let's look at the hazard. UV rays can exposure is seen in welders, X-rays in radiologists, infrared rays in glass blowers. Okay, these are certain radiation hazards. Safety, whereas safety, if you're looking, how do we ensure radiation safety? Shielding through lead aprons which are at least 0.5 mm thick. Next, periodic examination and replacement of workers every 2 months. You have some X-ray technician. That X-ray technician should be changed, should be examined every 2 months, and ideally they should take shifts of every 2 months so that they're not always the X-ray technician in a place, because it will increase the risk of radiation exposure, right? And if we want to measure the radiation dose, you have something known as a TLD badge, thermoluminescent dosimeter. You can have a chest TLD badge to measure the whole body radiation dose. You can have a finger TLD badge to measure the finger radiation dose. You can have a wrist TLD badge to measure the extremity TLD dose. That is about where you place it. What does a TLD badge have? It has lithium fluoride crystals. These lithium fluoride crystals, when exposed to radiation and then heated, they lighten up, they luminescate. So this luminescence can be measured by a TLD analyzer, and you can therefore indirectly measure the amount of radiation. So basically TLD badges is to see people who are regularly exposed to radiation, to see the dose of radiation they're exposed to, whether it is healthy or unhealthy, or if it is a big hazard. So that is about radiation. So remember, where all can you be exposed to radiation? Shielding through lead aprons, periodic examination and shifting, and TLD badges. Next, coming to sickness absenteeism. Basically, what is sickness absenteeism? It is equal to the number of worker days absent divided by the number of working days available. Or number of worker days absent is nothing but the number of workers absent into the number of days absent. So if you have in a month 5 workers are absent for total 10 days. Okay, so the number of worker days absent are the number of workers absent, that is 5 workers, into 10 days. So 50 divided by the total number of working days available, that is 30 in a month, right? So assuming it is 30. So that is sickness absenteeism. So remember, sickness absenteeism in India is average for about 8 to 10 days per year. Sickness absenteeism. It tells you the health status of a worker in a given job. So the indicator of health of a worker is given through sickness absenteeism. What could be the reasons for someone to be absent for work? Social reasons like weddings, festivals. Economical reasons like I have by the end of the year, if a worker still has 10 paid leaves, they'll still use it because they know it's paid leaves, right? Even if they're not sick, they'll still use the paid sick leaves. That is economical sickness absenteeism. Social sickness absenteeism such as weddings, festivals. Medical sickness absenteeism, because of actual illness they're taking sick leaves, occupational injuries, illness, etc. Last comes non-occupational sickness absenteeism, because of alcoholism, drug addiction, etc. How do we prevent this sickness absenteeism? Through ergonomics, through improving human relations, through improving factory practices. So by having good ergonomics, they don't feel like, oh, it's like it improves the patient well-being, improves the worker well-being. By having better human relations, improves the worker well-being. By having better factory management practices, this will improve efficiency, worker well-being. So then the worker won't feel like, utilizing all the sick leaves. So that is the way to decrease sickness absenteeism and to improve the health status of a worker. So this is it for occupational health part 1. I'll upload about pneumoconiosis in the next video.